Oh, baloney. The whole thing always gets back to drugs.
Hello, my name is Sandro Grassa and I'm a licensed acupuncturist. First of all, thank you so much to everyone that has subscribed. It's absolutely fantastic. We have something like 800 views at the moment and you guys are making this a great fun thing to do. So keep those ideas coming, keep those suggestions coming. We are just absolutely loving this. So it's all because of you. Keep those ideas coming. Subscribe to the channel because there might be some live events coming up soon. So we're just working on those. And if you're subscribed to the channel, you'll be the first one to know. So just keep an eye out for that one. Now, I know that it's about a month and a bit away from Halloween, but yeah, today we're going to talk about blood. Yeah, we are. So we're going to talk about blood tests and blood test results, particularly for women, and we're going to just focus on something very specific about what does your results came back normal? What does that mean? Okay, so just as a quick example, this came up in the clinic just really recently, and someone said that they'd been to their GP, they asked to do bloods because they checked online and they knew that everyone always looks for just a general picture of, not just general picture of health, but actually checking the hormones and everything. In our clinics, when it's someone going in for the first time, we actually ask for everything. So we go from liver function, kidney function, we get cholesterol, glucose, vitamin B12, vitamin D, prolactin, all the hormones. We ask for everything because that way you can have a full picture of what you are at that particular time. And if you get pregnant within the next few cycles, great, that's fantastic. If it takes a little bit longer, when you go and repeat those bloods, you have something to compare and contrast. And you can then see what has changed between your lifestyle and dietary changes, between your acupuncture treatments, what has changed and what has made a difference. So that's why we always ask for everything. But a lot of the times, especially if you're doing these with your GP, your general practitioner might not have that deep knowledge of gynecology or endocrinology. And you're going to get the phone call back saying that your results are back and they all came back okay. But what does okay mean? This is where we want to focus today. You might have seen something online now called the functional ranges. And what that means is that it'll be really important for you as a patient to know exactly what was your result. And your particular one, it being B12, D, whatever it was, what was the exact number and whereabouts on that normal range, whereabouts are you? Are you just really close to the low or are you just really close to the high? Okay, so this bearing in mind that sometimes in the same city you might actually have different labs having different ranges. Just as an example, two labs that we work the most with here in Dublin, one of them for the vitamin B12, the range is 160 to 600, and on the other one the range is 211 to 760. So you see that there is a difference there. So whereabouts are you on that range? So if you just get the phone call saying that everything is normal, where in that normal scale are you? So pretty much as consensus from everyone, you will see this online and you'll hear this from different practitioners, the functional range. So by consensus, that's about taking 20% from the low side and 20% from the top side, and then just count everything that it's in between. So that middle, so if you take the 20% and take the 20%, what you're left with, that's your functional range. So if you want to use another word, that's your optimal range. Just as a quick example, again, related to trying to conceive, as you all know, during the first few weeks of pregnancy, there's a very high demand on iron and B12. So if you go do your blood test and your iron comes back normal, but actually when you ask what was the proper result and you hear that your iron came back at 11 or your iron came back at 14, and just to give you the quick range, it's the average is to be anything between 10 and about 30 for a female. I think it's 10.1 to 30 point something or other, just about 10 to 30. So If you hear that it's normal, which would be 11 would be normal, and 14 would be normal, and 28 would be normal. But which one do you think is optimal? Because that 14, and bearing in mind that there's always going to be a little bit variation on that, that 14, even during those first few weeks of pregnancy when there's a high demand on iron, even if it drops a little bit, it's still within the okay range. But the 11, if the 11, if that woman that got that 11 as a result and was told it was okay, within those first few weeks of pregnancy, that is probably going to go into that red zone. And that's not ideal. Might not have any impact, might feel a little bit more tired and whatever, but it's not ideal. So you want that on the optimal range. So it's a little bit like a instructional, but also a tip. Always ask for either the full printout so that you can bring to your practitioner, it being, your gynecologist or your endocrinologist, your fertility expert or your fertility acupuncturist, because we will now have to read those as well. Always ask for the printout, or when you get the phone call from your GP's office, if it's a GP or if it's a secretary, just always ask, okay, can you actually give me the full results so that I have them and I know exactly where I am within that range. Another quick example, just to really reinforce how important it is to know how much your full result is. Recently, it's probably about 2 years, maybe a bit more than 2 years now at this stage, here in Ireland, the vitamin D levels of normal actually changed as well. So everyone that might have not noticed this might still be looking at, oh, my vitamin D came up as 30, so that I remember that's normal. Actually, the ranges have changed. So what used to be 0 to 25 as insufficient and then 25 or more as sufficient, nowadays you take it as 50 or more as being okay, 25 to 50 as being insufficient, and 0 to 25 as being deficient. So that's a big change in the range, where now you want twice as much as what used to be the normal, the start of the normal range, is now where the okay starts. So it's important to keep an eye on what the ranges are, and it's very important that your GP knows why you're doing the bloods, because if you tell them that it's because of fertility, they'll pay a little bit more extra attention. It's important that you communicate with your fertility acupuncturist what you're doing when you've done the bloods and what were the results then, and then again what vitamins and what supplements are you taking to help with those. And it's important for you as well, because the more information you have, what do they say? Information is power, something like that. So there you go. Any other questions that you might have about this, and I know that sometimes it can be quite specific because of your own ranges and your own results, that's fine. Get in touch with us. You can do it by email, or you can go on the website and there's a form that you can just send in to either of us, and we can just have a look and just talk to you and in more privacy and just go through those details with you. And if you have any comments or any suggestions about this video or any of the other videos, as usual, leave them in the comment section below and we'll talk about it as soon as we can. Remember to subscribe. As I said, there may be a few live events coming up very soon. And until next time, be kind and be healthy.
Oh, baloney. The whole thing always gets back to drugs.